going to attach there. On the test, a lot of the questions for the holes are going to come from this view because we can see and I'll use pipe cleaners on the test too. The foramen and magnum, which is big, magnum for big. Okay. And then we have a hole just in front of it and to the side called the jugular. And that's the one that drains the blood from the brain. And then just in front of the jugular is the carotid artery, round like an artery should be. So to remember these, sometimes my students will say MJC.
Oh.
Magnum, jugular, carotid, MJC. Okay, so those are the main three holes that we're learning. The foramen is the word for hole. That's a good test question too. How do we say hole in anatomy? Foramen. Okay, good. Now for the superior view of the skull, we have the important sella turcica, which is the place where the most fragile gland in the whole body, pituitary, sits right there. The body's wise, right? It protects that little fragile pituitary, because you'll die if that thing gets injured. Okay, in front of it, you just slide your finger forwards, and you have a crest right where my finger is, and that is the crista de gallo, the crest of the rooster, or in anatomy we call it crista galli, right there. And that's where the membranes of the brain anchor in, so the brain's not sloshing around. It's one of the anchor points. It's surrounded by a cribriform plate, and that is where our sense of smell is. You know, we take a sniff, and there's receptors right up to that cribriform. And sometimes people get injured in an accident, and they lose their sense of smell, because that cribriform is really fragile. Frontal bone here. Now let's look at some of these bones. Scapula. We're learning two processes. We're learning the acromion, which is big. That's on top. Think of the alphabet. A comes before C in the alphabet. Acromion before coracoid. All right, and they're going to tie in with the head of the humerus. And we have these bumps, right? We have tubercles to hold the ligaments, and then we have a deltoid tuberosity coming over the top. Right, big muscle. So that roughened area is a tuberosity. Continuing down, we have the perfect fit between the trochlea and the ulna. Remember, the ulna has a U? And that's not going to confuse. Sometimes on a test, I'll just say, what's the name of that bone? If you pick that up and think, well, is that a radius or ulna?
It has a circle.
Yeah, well, that would never work as a radius or ulna. It must be, because some of you guys just have to think about this. It must be a fibula. And remember, the name for the ankle bone is malleolus. This must be a left leg because we know that in soccer and in football you can't hit people from the side because the fibula is lateral and it's so fragile, it snaps. So this must be the lateral malleolus, lateral ankle. This must be the medial malleolus, or the medial ankle. Tuberosity here, so that we can keep the femur and the tibia lined. We have a big rough tuberosity right there. And while we have the femur in my hand, two condyles that articulate there, but one's medial, one's lateral. They look kind of similar, so we have to look at the head of the femur and say, okay, this is a left leg, and this must be the medial or midline, this must be the lateral. So a lot of these things do make sense. Vertebra, pretty easy. That little guy could never hold up your whole torso. Must be a cervical. This one has a long spinous process, so that must be a thoracic. And then the huge lumbar with a big body down low. The foot's pretty easy because the talus is on top. T for top. And that is where the tibia, see how smooth it is? That's where the tibia is going to articulate. So the talus, calcaneus is the huge bone here, the heel. Then the navicular is kind of hard, it's a little boat-shaped guy. And then there's 4 C's in a row. Cuboid, which is cube-shaped. And then the cuneiforms, lateral, intermedial, and medial. Metatarsals, phalanges, distal means tip, proximal means base. And this is one that we learn different ways. Like this is it'll always be palm side up on a test. Because on the palm side, you can see the pisiform, and you
Pisiform.
can feel the hamate. And you can feel these on your own wrist. You can feel the pisiform. You can just push and feel those guys. All right. Capitate for center.
Mm-hmm.
Scaphoid is a huge one at the base.
Lunate's the center.
So long to pinky, because now we're at the pinky.
Mm-hmm.
Here, hamate comes the thumb. We're at the thumb side. Or some others try positions that they can't handle. The important thing is really the shape. Hamate with the hooks, capitate in the center. Lunate is a crescent moon. Scaphoid is kind of S-shaped and big. Pisiform, the P. Triquetrum, I never have figured out a good way to remember triquetrum, except it's on the pinky side. And then trapezoid, trapezium, those words sound real similar.
Mm-hmm.
But think of trapezium and thumb.
Oh, okay.
See that? Here's a thumb,
Mhm.
trapezium, thumb. And the trapezoid is trapped in between these two. But pelvis is kind of tough. Like, wow. Ilium, ischium, pubis. Try it on. Pubis points forward. Okay, when women are pregnant, sometimes that connection there becomes softened and loosened, so that it helps with the delivery of the baby. So pubis points forward. Ischium round like your booty. Ilium up top, where a lot of muscles tie in.
That's it.
Yeah, we know these, right?
Yeah.
Radius round.
Yeah.
Ulna.
See you. Yeah.
Yeah, that's it. That's really the test.